All right. So I'm doing iron deficiency as my presentation, as my research project for this week's discussion. And so let's just get started. So so what is it? So iron deficiency is the most common deficiency in the world. It's when red blood cells struggle to carry out oxygen because the iron actually puts something in the blood that allows it to bind to the oxygen. And when this happens, we become very tired. That's like one of the main symptoms you'll see with iron deficiency. All right, so going into symptoms, over here you see Edward Cullen. Edward Cullen, right now, he looks pale, he looks weak. He's got cold hands and feet for obvious reasons. But some other things you may see is headaches, dizziness, and with children there would be poor appetites. Um, and so yeah, that's something to look out for. And then so going on, what are the causes, the etiology? So blood loss, right? So iron loves your blood. So wherever it goes, it's going to want to go too. So if you lose blood, then you're going to lose some iron, some iron storage. And a lot of reasons people also are iron deficient is they don't eat enough of it. There are lots of foods like meats, leafy greens, legumes. These things would all have irons, like oysters. If you want to eat oysters, have a ton of iron in them. And some people are unable to absorb iron. We'll talk a little bit more about that. But basically, it's like there are things that allow you to absorb iron better. Vitamin C is a big one of those, so we'll get more into that later. And pregnancy. So when people are pregnant, they need more iron because it's not only for themselves, but it's for the fetus. And so we have to take that into account when if someone's pregnant, make sure they're getting even more iron than normal. So risk factors. With risk factors, we would see that women, infants, and children, and by the way, I like was telling my presentation someone earlier, and risk factors, they thought that women would cause you to be more iron deficient, but no, if you are a woman, if you are an infant. And so the reason is for women, it's basically because menstruation, and also they're just at higher risk. With infants and children, they need it more because for growth spurts, they use more iron. And vegetarians usually, like I talked about before, that meat has iron in it. And so if they're not eating meat, then they may not be getting enough iron in their diet. And frequent blood donors, like I said, iron's going to go where the blood goes. So if you're donating blood, iron's going to go with it. Um, and so going into complications, what we see here, she's actually pregnant in this picture. So she has problems during pregnancy, right? What this can do is have premature babies, or even the baby can pass away. There can be heart problems and growth problems with kids. And so with diagnosis, blood tests are done. So blood tests are usually done before, but then they'll like go more deep into it to see um, like specifically what are your iron levels at, and then they'll test your bone marrow, and then also in upper lower endoscopy is something where you're going to see like how much blood are you losing, to kind of keep track of, is this the reason why you are iron deficient. And so with treatments, we look at this. There's iron-rich diets, right? We talked about that. You want to eat your meats, you want to eat leafy greens, you want to eat your lima beans and peas, and other legumes. Iron supplements are something that people take. And then evaluate source of blood loss. Many people don't understand that they're losing so much blood. So over here, we'll see that she's saying, I know what you are. He says, say it out loud, say it. She says, vampire. So the vampire is identifying the source of blood loss. So that's pretty cool. So recommendations. So we're going to see over here that we have Team Jacob and his squad. They're looking very good. They look like they're not iron deficient. And why is this? Because they eat iron-rich foods. They're eating foods containing vitamin C, which allows them to absorb iron better. And then they're going to have breast milk and iron fortified formula when for their children, for their babies, not themselves. But yeah. Anyways, they yes, breast milk is actually is way better for you than formula. So do that for your kids if you have a choice. And if not, then go for iron fortified formula. And then I was reading a journal entry or an academic journal about cook with lucky fish or cast iron, and this kind of just goes over that when you cook with these things, like a lucky fish is this metal fish that you throw in like a soup or stew, and it's going to have iron come off of it and then go into the food, and then therefore you have more iron in your diet. Cast iron's the same thing. When you cook with cast iron, metal's going to come or iron's going to come off the the pan, and then you're going to be able to just have more iron that way. And so basically, if you do this, you'll be able to have more energy, have more strength. You'll be able to have more color in your skin, which I guess people want. And yeah, and so do these things, and hopefully you can avoid being iron deficient.